Hi, I'm Kimberly Reyes from Pixels and Pills, and I'm here with Kurt Mueller, and he's the Chief Digital and Science Officer for Roska Digital. How are you, Kurt?
I'm doing great, Kimberly. Thanks for having me today.
No problem. I'd like to talk with you about the marriage of creative and digital and how important that is to the emotional connection with the patient. Do you have a couple words about that?
Absolutely, and I think you hit the nail on the head. I think it's absolutely critical. So I think creating environments that patients can engage in and interact with and that are stimulating visually, tactically, if they can touch things, and auditory, sensory is very, very important. So what we find in marketing, and especially in healthcare and patient marketing, is that creating that creativity and that connection is important to get them engaged and then deliver relevant messages and content that's important to them. So the marriage of those two, and also the ability to measure the interactions of what's valuable and what's meeting their needs and what's not, is equally important. So I think if you combine the three, that's really where you get the mix of the secret sauce that makes everything work.
Great. We're calling this year the year of change in the pharmaceutical industry. What changes and challenges are you most concerned about?
Well, I think it's going to be interesting, obviously, with all the noise around the FDA regulations. I think that the industry is making some steps in the right direction to start to try and push the process forward. And I think we're going to see great things happen. I think the FDA is opening up to ideas. I think pharma and marketers are operating a bit more responsibly. I think they're doing the best they can with intent to try and do good and be transparent. And so I think some of the changes that we're seeing is really, an opening up of transparency, honesty, disclosure, and even links to sites like MedWatch where consumers can interact with the FDA. So I'm really excited to see that, and I think that's going to get more pharma marketers involved in social media.
Speaking of the FDA and social media, since the deadline for the FDA submissions, what do you think has been left out, or what do you think were standout suggestions to you that were submitted to the FDA?
That's a great question. And I was a little bit disappointed in the responses being somewhat generic. So if you read the responses that were posed based on various different submissions, I would have liked to have seen a little bit more interaction there. But I think that a lot of good ideas were submitted. I think the thing that we're missing is data. So I think the more that we as an industry, the agencies, the pharmaceutical companies, can actually supply supportive data that's demonstrating health literacy with simpler ISIs, better connectivity through one-click click-throughs to the right destinations. If we can actually build studies that will actually support that data, I think we have a much better chance of success of the FDA accepting that and saying, yes, this is a good practice. So I think that was a missing piece. Some of the highlights that I think are great are, I think Google's beta technology that they're using for the ads are trying to do the right thing, connecting right to the ISIs and the important information. I think that's a wonderful thing. I think some of the social media policies that the companies are putting together with the best intent of what the FDA wants to do is also a step in the right direction. So I think there were some key takeaways there that were just excellent, and I think it's going to move the industry ahead of the guidelines, actually.
Okay. Since we're at the DTC conference, can you talk a little bit about how the differences between marketing to the patients and marketing to doctors?
Yeah, that's another great question. I think how you communicate is different. So physicians have different needs. If you read the recent Cyber Citizen report, the physicians are actually interested in the medical and relevant product information. The consumers are interested in the health management and also the product information. So really, the way that we need to talk to the two different audiences are different. Also, what translates for healthcare practitioners does not really translate well for consumers necessarily. So what we try and do is take a different approach, speak more in common languages, more approachable, friendly, trying to create an emotional connection with the patient. And on the physician side, trying to create an equally effective emotional connection, but around their needs, about solving problems, about establishing good relationships with their patients, getting better patient outcomes. So really the approaches that we take from a patient standpoint to a healthcare professional standpoint is a little bit different. And then ultimately what we want to do is connect those two, because I think when you get the two together and you get them talking is when you get really the best patient outcomes. So I think whatever it is, mobile, web, television, whatever the industry can do and the companies can do to better connect HCPs with their patients, and then ultimately if pharma can be involved in that conversation, I think that's the win-win all around.
I agree. Are there any remarks you'd like to leave us with?
Well, I think it's to have everybody keep going forward, innovate. I think digital technology is an opportunity to really help the FDA solve some problems. I think they're open to it. They're even using it if you look at their own Twitter feeds and things like that. So I would say keep innovating, keep trying, be responsible, be transparent, and I think we're going to do fine. I think we'll actually police ourselves fairly well, and I think if everybody can operate above board and with the best intent, we're going to have some great communications coming out in the next 2 years.
Thank you so much, Kurt, for taking time out of your busy schedule to talk to us. This is Kimberly. I'm from Pixels and Pills, and you're at the DTC National Conference. The registration is open. You can drop by if you're in the area.